obviously there's a lot of single-arm phase 2 studies in follicular lymphoma that always look very promising, but it's hard to really navigate as those move into the treatment landscape. What's the most impactful therapy that's coming on the scene for patients? And so in the absence of head-to-head comparisons, and they're becoming more and more challenging, particularly as our therapies get a little bit more resource heavy, we're not likely going to see the randomized studies we'd like to see to really answer that question. So can you utilize sort of advances in technology to do indirect matched comparisons? And so that's what we set out to do. Look at the results of the single-arm phase 2 of Lisocabtagene maraleucel in relapsed refractory follicular lymphoma. Take that patient-level data and compare it to the most recent FDA approval in that same space, which is Mosunetuzumab, CD20, CD3 bispecific antibody. And again, there are clearly limitations of this approach, but we can at least take the patient-level data from 2 single-arm phase 2 studies and then try and match them as best we can in terms of baseline characteristics, and then look at the outcomes of interest in terms of efficacy and safety. And so when we do that, it does appear that liso-cel can result in more favorable response rates and even progression-free survival. Safety was a little bit interesting in that there were more favorable CRS grade 3 or higher, actually, with CAR T-cell therapy, but we saw more ICANS or neurologic toxicity because there was differences in terms of definition of that toxicity. So again, it's not going to replace a prospective randomized study, but it is an interesting analysis that suggests that Lisocabtagene maraleucel can actually compare quite favorably to Mosunetuzumab for relapsed refractory follicular lymphoma.